Classically, the pain is quite sharp near the top of the elbow. So in the case of tennis elbow, the medical term for tennis elbow is lateral epicondylitis. The epicondyle is just basically the medical term for elbow, but it means the lateral side, meaning the outside, so this part of the elbow. As I say, the pain will be usually sharp at that point of the elbow. You may also have an achy feeling midway down in the belly of those muscles where they insert onto the elbow. For golfer's elbow, the pain is on the inside, and again, it's usually where those muscles and tendons have become inflamed, and the pain in both cases often comes on when you squeeze the hand. With golfer's elbow, it could also happen with a forehand shot in tennis or in golf, or in just flexing the wrist towards the palm of the hand coming towards the forearm. With tennis elbow, often it's a backhand shot in tennis, which is the classic one. But again, you don't have to play sport, you don't have to be a tennis player or golfer to get these conditions. Often you'll see these sort of conditions as a repetitive strain injury, for example, with people who spend long hours typing at a keyboard, again because these muscles and tendons are getting overused. In my opinion, the place to start with is a combination of shockwave therapy, deep massage and acupuncture. If I had to choose just one of those, then I would say the shockwave therapy. Over the years, I've treated many patients with these conditions, and in the vast majority of cases, the patients have done well. They haven't had to have injections or any surgery. If I did have a stubborn case though, and I had to steer them towards something else, and especially if we found that there was a tear in the tendon, then I would steer them towards a special type of injection called PRP, or platelet-rich plasma. I would try to avoid the classic steroid injections on the elbow because there is a risk that can cause further damage, and especially these days, the trend is now coming towards, as I say, these newer injections called PRP. I think the number one tip I would give patients, and if it was me and I was the one who had those conditions, it would be to perform a kind of warm down stretching and even self-massage at the end of activity. So if you're struggling with these conditions, if you're struggling with tennis elbow, golfer's elbow, I think it's very important that at the end of activity, at the end of playing sport that could have flared up that condition, you may not feel it immediately after the sport because sometimes this swelling takes some time to accumulate, a few hours. But I always would try to end with some good stretches. But I say, in addition to the stretches, do some self-massage techniques, and that's something we will teach you when you come to see us.
Thank you for watching this video all the way through. For effective treatment and advice for muscle and joint problems throughout the body at either of our clinics in Chigwell or Woodford, call us at SpinePlus to book an appointment on 02 08 501 0937. You may like to know that we've made several other videos with information and self-help tips on specific problems, everything from tension headaches to heel pain. Some of our suggested videos are shown below, or you can search our playlist to discover more. We'd also be really grateful if you could like and share any videos you watch, and please subscribe to our channel by clicking on the subscribe button to be kept informed of our latest information. For more information on our clinics, click Find Out More to be directed to our website.